Hello all, welcome back to my channel. This is once again Dr. Sonia Mosakuti, and today I will be dealing with the topic named the smile design and the conservative aesthetic procedures. So if you are new here, please don't forget to subscribe my channel and please press the bell icon so that you won't miss any of my future videos. So there are some terms which are necessary to understand the concept of smile design. These include aesthetics and appearance art. The term aesthetics refers to the art and science of beauty. While smiling, a person typically displays a maxillary anterior and premolar teeth and frequently maxillary first molars also. This zone of exposure during the smile is called as the appearance zone. So next we can go through the components of the smile design or smile aesthetics. The overall components of the smile can be divided into 4 groups: the facial aesthetics, the gingival aesthetics, macroaesthetics, and the microaesthetics. So the first one is the facial aesthetics. The facial aesthetics in the smile design include facial height, facial shape, facial profile, gender, and age. In addition, personality, hair color, skin tone also affect in designing the smile. The form of a tooth should conform to the contour of the face as viewed from the front and side. According to Leon Williams' classification, the facial forms or the shapes can be categorized as square, square tapering, and ovoid. When coming to the gender, the curved facial features are associated with femininity and square with masculinity. So, to create harmony between the tooth form and the face, teeth of the females may be more ovoid or tapering than square as compared to the males. The incisive edges may also be rounded for females. When coming into the personality, a vigorous personality requires a square teeth with flat incisal edges, while a delicate personality will require ovoid teeth. As the age advances, the teeth wear at the incisal edges and the interproximal surfaces. So, the second component of the smile design is the gingival aesthetics. The health, symmetry, and architecture of gingiva are the next essential elements in the smile design. The gingival components include the color, contour, texture, and the height of the gingiva. The healthy gingival tissues are pale pink and can vary in degree of vascularity, epithelial keratinization, pigmentation, and in the thickness of the epithelium. The texture of the tissues should be stippled in most of the cases. In younger females, the tissue is more finely textured and has a finer stippling when compared to that of the males. The architecture of the gingiva refers to the positive radicular shape, that is, forming a scalloped appearance that is symmetric on both sides of the midline. The marginal gingival tissues of the maxillary anterior teeth should be located along a horizontal line which is extending from the cuspid to cuspid. Ideally, the laterals reach slightly short of that line. So, while studying about the symmetry, it is important to understand the term gingival zenith. The gingival zenith point is the most apical point of the gingival tissues along the long axis of the tooth. This most apical point is located distal to the long axis on the maxillary central and cuspids. The zenith point of the maxillary laterals and the mandibular incisors is coincident with the long axis of these teeth. The third component is the macroaesthetics. This refers to the composition consisting of the lips, its relationship with each other, anterior set of the teeth, and its dynamic quotient with the lip activity. Macroaesthetics include lip analysis, lip morphology, lip mobility, smile line, midline, balance, length of incisors, incisor angulation, radiating symmetry, incisal embrasure form, and buccal corridor. So, the first point in the macroaesthetics is the lip morphology. 3 aspects of the lip morphology should be considered are width, fullness, and symmetry. A smile that is at least half the width of the face is considered aesthetic. The fullness of the lip or lip volume can be categorized as full, average, or thin, and this is arbitrary. Lip symmetry involves the mirror image appearance of each lip when smiling. So, coming into the lip mobility, the position of the lips in the rest position should be evaluated for lip contact as well as for the range of lip mobility when smiling. In the case of smile line or the incisal curve, which is made up of the incisal edges of the maxillary anterior teeth and parallels the inner curve of the lower lip, it is parallel with the interpupillary axis and perpendicular to the midline of the face. With the upper lip at the rest, women show approximately twice as much as maxillary central incisors as men. Coming into the midline. The midline is a focal point of the smile. It is centered on the face perpendicular to the interpupillary axis. Facial and incisal midlines need to coincide. This coincidence is important when planning orthodontic treatment and when planning treatment for prosthodontics. So the next one is the length of incisors. The length of the maxillary incisors is important since they play an important role in phonetics and anterior guidance. So aesthetic alone cannot establish the length. The patient utters the letter F, the incisal edges of the maxillary incisors with the correct length will be placed against the inner edge of the vermilion border of the lower lip. The sounds M and E also determine the incisal length. The F or V sound determines both incisal length and incisal profile. The next point under the macroesthetics is the radiating symmetry. If teeth have different shapes but the left and right sides are mirror images of each other, it is called as the radiating symmetry. Next is the incisal embrasure form. The incisal embrasure is an open space that is formed between the proximal surfaces of the incisal edges from the contact points. The incisal edges of the maxillary central incisors and the cusp tips of the canines should be on the same gently curved horizontal line with the lateral incisors nearly 1 mm above the line. The incisal embrasure becomes progressively larger in the posterior teeth. Next is a buccal corridor. The area between the corners of the mouth during smile formation and the buccal surfaces of the maxillary teeth form a space which is known as the buccal corridor. A full and symmetric buccal corridor is an important element of an aesthetic smile. Several factors affect the buccal corridor, which include the width of the smile and the maxillary arch, the tonicity of the facial muscles, individual smiling characteristics, and so on. That comes to an end to the third component of the smile design, that is a macroesthetics. Coming into the fourth component, that is a microesthetics. So specific incisal translucency, patterns, characterizations, lobe development, and incisal haloing are all components of the microesthetics of each tooth. The microesthetics include specific tooth form and shade matching. The different tooth forms can be correlated invariably to the sex or personality and specific age, which have been explained in dendrogenic concept, which I explained earlier in the facial aesthetics. Next is shade matching. The maxillary central incisors are the lightest teeth in the mouth. In most individuals, the lateral incisors appear to be of the same hue as the central incisors but slightly less intense, therefore they look less bright. The canines, both maxillary and mandibular, often show a much more intense chroma, sometimes appearing much darker than the teeth adjacent to them. In the cervical area, the reduced thickness of the enamel makes the color of the dentition more evident, producing greater chromatic saturation. Thicker enamel, on the other hand, produces a marked translucency in the incisal third. So, before ending the topic smile design, it is necessary to understand the concept of golden proportion. The concept of golden proportion to dentistry was first mentioned by Lombardi and later developed by Levin. In simple terms, the ratio between the succeeding terms is approximately 1:1.618 and is known as the golden proportion or the divine proportion. The golden proportion, which is found in many aspects of the natural world, is presented in a mathematical progression called as the Fibonacci series, in which each number is the sum of the two immediately preceding it. That is 1, 1, 2, 3, 5, 8, 13, 21 and so on. So, in dentistry, Levin demonstrated that the three anterior teeth, that is the central, lateral and the canine, and sometimes the premolars, are in golden proportion to the width of the smile. So that comes to an end to the topic smile design. Since the topic is huge, I will be continuing the next part of this topic, that is the conservative aesthetic procedures, in the next video. Till then, it's Dr. Sonia Musakuti signing off. Thank you.